Communication and interaction support. Person-centered communication. Person-centered communication is a foundational practice in health and social care. It involves adapting how we interact to meet the unique communication needs, preferences, and abilities of each individual. For people with learning disabilities or autism, communication differences are often significant, and poor communication can lead to distress, isolation, or even safeguarding risks. Rather than expecting the person to fit into a standard model of conversation, person-centered communication starts with a simple question: how does this person prefer to communicate, and how can I support that? This approach builds trust, enhances understanding, and promotes autonomy. It supports inclusion, dignity, and choice, key elements of person-centered care under the CARE Act 2014, the Equality Act 2010, and CQC fundamental standards. Principles of accessible, inclusive, and respectful interaction. To make communication truly person-centered, care workers should follow these core principles. 1. Accessibility. Use formats that the person understands. This may include easy-read documents, symbols, visual timetables, or audio support. Speak clearly, avoid jargon, and break information down into manageable parts. Ensure that physical environments, lighting, noise, seating do not overwhelm individuals with sensory sensitivities. 2. Inclusion. Involve the person directly in all conversations about their care. Use supported decision-making if necessary. Encourage use of communication aids, for example, Mercaton, PECS, talking mats where appropriate. Include family members or advocates only when invited by the person, or when legally required, for example, under the Mental Capacity Act. 3. Respect. Let the individual take the lead in how they communicate. Some people may prefer gestures, silence, or digital devices. Acknowledge all forms of communication, verbal, non-verbal, behavioral, as valid. Respond with patience and attention. Rushing communication or ignoring attempts to express preferences can undermine trust and rights. Avoiding assumptions or stereotyping. One of the biggest barriers to effective communication is assumption. Care workers must remain professionally curious and reflective, avoiding generalizations based on diagnosis, age, appearance, or behavior. Common assumptions to avoid. Assuming someone who is nonverbal cannot understand. Believing all people with autism avoid eye contact or dislike social interaction. Expecting individuals with learning disabilities to process information at the same rate. Interpreting quietness or distress as non-cooperation rather than unmet need. Best practice includes asking, how does this person usually communicate? Checking understanding using open questions and visual supports. Valuing cultural, gender, and individual identity differences in communication style. Being flexible, what works one day may not work the next. Effective communication is not only a skill, it's a responsibility. By placing the person at the center of every interaction and tailoring your approach, you help uphold their rights, dignity, and autonomy. Person-centered communication is essential for meaningful engagement, accurate assessments, and safe, inclusive care. Common communication differences in people with autism and/or learning disabilities. Communication is far more than just spoken words. It includes tone of voice, body language, facial expressions, gestures, and even behavior. For individuals with autism and/or learning disabilities, communication differences can be profound, varied, and deeply individual. These differences should not be interpreted as deficits but rather as alternative ways of interacting with the world. Understanding these differences is critical for care workers to deliver respectful, person-centered support and avoid misunderstandings or unintentional exclusion. 1. Expressive communication differences. Expressive communication refers to how a person conveys their thoughts, needs, or emotions. People with autism or learning disabilities may use limited or no spoken language. Communicate primarily through gestures, facial expressions, vocalizations, or behavior. Use augmentative and alternative communication AAC tools like Makaton, Picture Exchange Communication System PEX, or communication boards. Echolalia may occur, where phrases or words are repeated without an immediate understanding of meaning, sometimes serving as self-regulation or delayed expression. Speech may be present but differ in tone, rhythm, or volume. For example, a person may speak in a monotone or with an unusual pitch, or may use formal or repetitive phrasing. Key takeaway for care workers: do not judge communication ability solely by speech. Non-verbal communication can be equally meaningful and should always be acknowledged and supported. 2. Receptive communication differences. Receptive communication is how a person receives and processes language. This can be significantly affected in people with both autism and learning disabilities. Individuals may struggle to understand abstract language, metaphors, or idioms, for example, pull your socks up. Require concrete, literal, and clear instructions. Vagueness can cause confusion. Need more time to process what's been said before responding. Experience sensory overload, which can disrupt their ability to focus on what's being communicated. Some individuals may appear to not be listening or may avoid eye contact. These behaviors are often coping mechanisms, not signs of disengagement or defiance. Practical response: use short, direct sentences and check understanding gently. Use visuals and consistent routines to reinforce verbal messages. 3. Social and pragmatic communication differences. People with autism particularly may experience difficulties with the social rules of communication, such as turn-taking in conversation, understanding personal space and body language, interpreting humor, sarcasm, or emotional nuance, knowing when or how to initiate or end a conversation. They may also focus conversations on topics of personal interest, sometimes perceived as talking at rather than talking with others. This is not rude, it is often an effort to connect in a comfortable way. For those with learning disabilities, cognitive limitations can also affect the ability to engage in more complex conversational exchanges or adapt communication style based on context. 4. Behavior as communication. It is crucial to recognize that behavior is a form of communication, especially when verbal expression is limited. Behavioral expressions such as withdrawal, agitation, or repetition may indicate unmet needs, for example, hunger, pain, confusion. Emotional states, for example, anxiety, frustration. Environmental triggers, for example, loud noise, unfamiliar settings. Understanding these signals requires familiarity with the person, patience, and reflective practice. Communication differences are not flaws to be corrected, they are variations to be respected and supported. Care workers must remain observant, flexible, and non-judgmental in how they respond. By doing so, they enable the people they support to be heard, respected, and fully involved in decisions about their own care and lives. Verbal, non-verbal, and augmentative communication tools. Communication is a fundamental human right and an essential component of person-centered care. In the context of learning disabilities and autism, it is important to recognize that communication may take many forms: verbal and non-verbal, formal and informal. Not every individual will use spoken language, and even those who do may have significant differences in how they express themselves or understand others. It is the responsibility of care workers to ensure that communication is not only supported but actively enabled, using a variety of methods tailored to individual needs. 1. Verbal communication. Verbal communication is often the most recognized form of interaction, yet for people with learning disabilities and autism, the ability to use and interpret spoken language can vary significantly. Common characteristics: delayed or atypical speech development, particularly in early childhood. Literal interpretation of language, figures of speech, metaphors, or humor may be misunderstood. Echolalia, where phrases or words are repeated, either immediately or after a delay. This may serve as a way of processing or expressing needs. Differences in intonation, volume, or pacing, speech may sound robotic, overly formal, or lack variation in tone. Practical strategies for care workers. Use plain, clear, and direct language, avoid idioms or jargon unless already understood by the individual. Speak slowly and calmly, giving time for the individual to process and respond. Check comprehension gently, ask the individual to repeat information in their own way rather than simply asking, "Do you understand?" Recognize and respect individual variations in how verbal language is used, and avoid placing undue pressure to speak properly. 2. Nonverbal communication. For many individuals, especially those who are non-speaking, nonverbal communication is a primary mode of expression. This includes forms of nonverbal communication. Gestures, such as pointing, waving, or using hands to indicate choices. Facial expressions, smiles, frowns, or other emotional signals. Eye contact, which may be avoided in autism due to sensory discomfort, not rudeness. Body posture and movement, which may indicate distress, excitement, fatigue, or engagement. Behavioral expressions, including self-soothing actions or changes in routine behavior that signal needs, discomfort, or preferences. Best practice guidance. Be observant, even subtle changes in behavior or expression may be communicative. Avoid misinterpretation, for instance, lack of eye contact is not a sign of dishonesty or disengagement. Respond consistently to communicative cues to reinforce that the person is being understood and valued. Use visual prompts, gestures, or objects of reference to reinforce communication. 3. Augmentative and Alternative Communication (AAC). AAC tools are systems that support or replace spoken communication. These may be low-tech, such as paper-based visual aids, or high-tech, like speech-generating devices. Key AAC tools used in UK care settings. PECS, Picture Exchange Communication System, a structured program using visual symbols to help individuals request or express ideas by exchanging pictures with their communication partner. Often used with children with autism, it's also effective for adults in supported living. Makaton, a language program using signs, symbols, and speech together. Unlike British Sign Language, Makaton follows the structure of spoken English and is especially helpful in environments like residential care or day centers. It supports understanding as well as expression. Communication books or boards. These contain symbols, pictures, or written words that individuals can point to. They can be customized to the person's interests, routines, or medical needs. Speech-generating devices (SGDs). Electronic devices, for example, tablets with AAC apps that produce voice output when a user selects symbols or words. Key considerations for care workers. Training is essential. Staff must be familiar with how to use and interpret AAC tools effectively, and organizations should provide training in tools like Makaton or PECS as appropriate. Consistency matters. All staff supporting an individual should use the same communication approach to avoid confusion and build confidence. Respect autonomy. Individuals should be involved in selecting the method or tool they prefer. Avoid forcing someone to use verbal speech if they communicate more comfortably through AAC. Record and monitor. Keep track of what works best and note any changes in communication patterns. This helps ensure continuity and responsiveness in care. Environmental support. Communication-friendly environments with visuals, quiet spaces, reduce sensory overload make it easier for AAC users to express themselves without stress. Every person has the right to be heard, and every method of communication is valid. The role of a care worker is not to teach someone to communicate like everyone else, but to listen, adapt, and respond using whatever tools and methods best support the individual. Whether through a spoken word, a picture card, a gesture, or a device, communication is about connection, and that connection lies at the heart of quality care. Using clear, respectful, and sensory-friendly communication strategies. Effective communication with individuals who have a learning disability or autism is not simply about what is said, but how it is said, and in what environment. Using clear, respectful, and sensory-friendly strategies ensures that individuals feel safe, understood, and able to engage meaningfully. Clarity is key. Many people with learning disabilities or autism process language differently. Spoken instructions or questions should be concise, unambiguous, and broken down into manageable parts. Avoid using idioms, sarcasm, or metaphors unless you are certain the person understands them. For example, instead of saying "hold your horses," say "please wait a moment." Use visual supports where needed to reinforce understanding, such as pictures, symbols, or written prompts. Respectful communication means treating individuals as equals, regardless of their communication style. Avoid speaking to adults as if they were children, and do not assume a lack of understanding based on limited speech. Always speak directly to the person rather than through their support worker or family. Allow adequate time for responses. Rushing can increase anxiety or lead to misunderstandings. Respect individual preferences regarding eye contact, tone, and pace. Sensory-friendly communication involves minimizing sensory overload during interactions. Bright lights, loud noises, strong smells, or crowded environments can cause distress or hinder communication, especially for individuals with autism. Choose calm, quiet spaces for conversations where possible. Speak in a soft, steady tone and avoid sudden movements or raised voices. Some individuals may prefer written communication, especially if they experience auditory processing delays. Be flexible and person-centered. Not every strategy will suit every person, and care workers must adapt their approach to each individual's communication preferences and sensory profile. When unsure, ask the person or someone who knows them well what works best for them. Ultimately, communication that is clear, respectful, and sensory-aware creates a foundation for trust, reduces anxiety, and supports genuine engagement in care. It is a professional responsibility and a human one. The importance of active listening and reading body language. In care settings, particularly when supporting individuals with learning disabilities or autism, active listening and careful observation of body language are essential communication skills. Many individuals may not use words to express themselves fully, or may communicate in ways that are nonlinear, delayed, or subtle. As a care worker, being attuned to these signals enables you to better understand and respond to their needs, preferences, and emotions. Active listening means more than simply hearing the words being spoken. It involves giving your full attention, minimizing distractions, and showing interest through posture, eye contact if appropriate, and encouraging gestures or phrases such as "I see" or "go on." It also requires withholding judgment, allowing pauses, and being patient when responses are delayed or expressed differently. Reading body language is equally important. A person may show discomfort, happiness, frustration, or fear through their facial expressions, posture, repetitive behaviors, or changes in routine. For example, fidgeting, turning away, avoiding eye contact, or becoming unusually quiet could indicate distress or sensory overwhelm. Smiling, relaxed shoulders, or reaching for a familiar item may suggest comfort or interest. For individuals with limited verbal skills, non-verbal cues may be their primary form of communication. Care workers must remain vigilant, interpret these signals within context, and respond supportively. Misreading or overlooking body language can lead to missed needs, increased anxiety, or behavioral escalation. In short, combining active listening with sensitive observation builds trust, reduces misunderstandings, and supports truly person-centered care. Supporting autonomy through accessible communication. Promoting autonomy, supporting individuals to make their own choices and exercise control over their lives, is a fundamental aspect of person-centered care. Accessible communication plays a crucial role in enabling autonomy, especially for people with learning disabilities and/or autism. Below are key ways care workers can support this through effective communication. Use plain and clear language. Avoid jargon, complex phrases, or ambiguous terms. Break information into manageable steps so individuals can understand and make informed decisions. Offer information in multiple formats. Provide verbal explanations alongside visual supports, for example, symbols, pictures, easy-read documents to reinforce understanding. Some individuals may benefit from written summaries or audio recordings. Check for understanding without pressure. Don't simply ask, "Do you understand?" Instead, ask the individual to explain in their own words or choose from supported options. Give them time to process and respond. Provide real choices, not illusions of choice. Instead of asking yes/no questions, "Do you want dinner?" Offer structured choices like, "Would you prefer pasta or rice?" This empowers meaningful decision-making. Respect preferred communication tools. Support and encourage the use of augmentative tools, for example, PECs, Mercaton, communication boards, or devices. Never remove or disregard a person's chosen method of expression. Create a calm, sensory-friendly environment. Reduce noise, bright lights, and distractions to support clear thinking and focused interaction, especially important for individuals with autism. Involve the individual in everyday decisions. Include people in planning routines, meals, activities, or care preferences. Even small choices build confidence and self-worth. Empower through predictability and preparation. Use visual schedules or social stories to explain what's happening next, reducing anxiety and giving the person time to prepare and participate willingly. These strategies ensure that communication is not only effective, but empowering, allowing individuals to make choices that shape their own lives. Thank you. You have successfully made it to the end of this module.